Hello, everyone. Welcome and thank you for joining us for episode 11 of Chain Reaction. My name is Taylor Young, and I am the Assistant Director of the National Keratoconus Foundation. We are a patient advocacy program based in Southern California at the University of California, Irvine. NKCF provides information to patients and their families and raises public awareness of this cornea disease. We invite you to visit our website, nkcf.org, and sign up for our newsletter and to register for our bi-monthly webinars. We also post news on our LinkedIn, Instagram, and Facebook pages. This is episode 11 of Chain Reaction, our Ask the Expert podcast. Our partner is Dr. Chang, a noted keratoconus expert and friend of NKCF. We often receive questions about life with keratoconus, and Dr. Chang has offered to share his advice on these questions. NKCF records and archives these episodes for the public. You can view past episodes by going to nkcf.org/webinars. Dr. Chang is currently the Director of Specialty Contact Lenses on the Cornea Service at Wills Eye Hospital in Philadelphia. He is also a member of the medical affairs team at Glaukos, which is the company that makes the FDA-approved crosslinking product and equipment. He is a graduate of the Pennsylvania College of Optometry and a fellow of the American Academy of Optometry. Dr. Chang was also named the NKCF Top Doc in 2020. Hello, Dr. Chang.
Hello, Taylor. How are you?
I'm doing well. How are you?
I'm pretty good. I think by now Taylor and I have recovered from our recent trip to a meeting that was all about specialty contact lenses. So I think we've gotten a lot of questions on that as well. And Taylor has curated a list of questions that she's going to try to stump me with. So I'm ready for you, Taylor.
Yes, we're very on theme with our trips right now. So our first question actually comes from Megan, who says that she has tried scleral lenses, but they do not work for her. So what other options does she have?
Right. So Megan, I'm sorry to hear about the fact that something hasn't worked for you, of course, as eye doctor, eye care provider, that we always want something to, to be able to work that we prescribe to our patients. And so the short answer is yes, there are other options that you will still have, depending on what exactly have you tried, either before or after your standard scleral lenses. And so let me kind of give a quick definition of what I mean by that. So standard scleral lenses that there are different levels of scleral lenses design that I use in my clinic. Some have more customization features and some have less. So sort of at the entry basic level, those lenses that I refer to as standard scleral lenses would have less customization fitting parameters. And I'm saying that because it is still possible that just because one level of scleral lens has not worked, does not mean that other higher level of customization will not work for you. So that's very important. The reason that is important is because I have a lot of patients who come in and say, oh, X type of lens didn't work, and then but that turned out to be actually the best option for the patient in that category. And I will, attempt to refit with more customization features and in many cases, I have made it work, even though it's the same type of lens. So that's something that, Megan, I think you should keep in mind and keep your mind open. But let's come back to your question specifically more to scleral lenses. And so these, standard scleral lenses have become really one of the more commonly utilized contact lenses and for medically necessary situations such as keratoconus patients, and for very good reasons, because scleral lenses are large enough so that they rest on the white part of the eye, which is called sclera, hence the name scleral lenses. And the reason that is favored in the last, let's say 5 to 10 years, it's because the lenses being that their resting position is to contact the white part of the eye, not just your cornea, which is the much more sensitive portion of your eye and harder or require much more time to get used to a contact lens that's solely touching your cornea. So we're bypassing the physiology, right? The sensitivity level of the white part of the eye of your sclera is much lower. So a scleral lenses typically then can be more comfortable and require less adaptation time. And so patients like that, and a lot of eye care providers like that as well. But I have had patients in my own experience who just cannot adapt to these scleral lenses, such as they may not be able to handle the size of the lens to put the lens, place it on the eye, or to remove it comfortably, or maybe they cannot get used to the sensation of having a large plastic-like material that's underneath their eyelid every time they blink. And that's just like a couple examples of why sometimes it cannot work. And so it's not for everyone, although it works most of the time. And so that's the reason why I'm less excited about the notion that, you know, many patients or doctors may have in terms of thinking scleral lenses is the end all and be all and it can accommodate every single patient's you know, unique profile, which I, you know, like I said, I feel like that isn't in the best interest of the patients themselves. So what other contact lenses then are available for keratoconus patients? Well, we're fortunate to have had many breakthroughs in contact lens technology in the past 5 to 10 years. And Taylor's bringing up an illustration that I have prepared for you from my own clinic. And so many of them, these new technologies have are in scleral lenses, but not only. So there are also breakthroughs in other lens categories. And while it's not possible to name every single lens design, let's at least take a look at what I have prepared for you of the major category of specialty lenses that are available for keratoconus patients. And because I often get to ask that this question by my patients or my colleagues, so that's why I have this slide that I typically use in my in my presentation during scientific symposiums. And so as you could see, there at the very least have 6 different categories of lenses that are available for keratoconus patients. The sort of gold standard decades ago were the gas permeable lenses, and that's the one that you could see with a little bit of a greenish tint in it that Taylor's circling for you right now. You can see that the lens ends prior to the color part of the eye, which is where your cornea is in front of. So it shows you that the lens is smaller than your cornea and therefore directly resting on your cornea, which is the much more sensitive portion of the eye. However, many patients, given enough time and sort of energy invested into getting used to these lenses, they are able to wear these lenses comfortably during most part of the day, and the shape of the lens being much more smooth than the keratoconus shape is what offers them the much better vision than most keratoconus patients can achieve with glasses, because that's not touching the cornea, that is away from the cornea. However, let's look at the soft keratoconus lens category next to the left of the gas permeable lens, or the RGP. So the soft keratoconus lens, many people may think, I didn't think that's possible. I was told that soft lenses are not possible for keratoconus patients. And again, that is true. We're not talking about your daily disposable throwaway single-use lenses that basically mimics the function of glasses, such as what I'm wearing. These are customized soft lenses that, using different fitting features, can actually mask part of the irregular shape of keratoconus, and therefore they can function well, especially in those appropriate patients, and especially in those with maybe mild or moderate severity level of keratoconus. So at the more advanced level, typically we do have to go to other lenses, and that part is true, but there are still soft lens options for keratoconus patients. Sometimes patients to the left of it is called piggyback. And sometimes patients who could not, after putting in enough time to get used to a gas permeable lens, they couldn't get used to it, but their vision is really good and they don't want to part with it. We could remember bypassing the physiology of sensitivity. So if we put a soft lens on, this time, most of the time, can be a disposable lens in my clinic, so that patients don't have to take care of both lenses. They just throw away the soft lens at the end of the day. and they take care of the gas permeable lens on the top. That's why it's called piggybacking, right? One is on top of the other. All they're doing is they're taking care, cleaning and disinfecting the top lens, and that's it. So still one lens that they have to take care of. It's just two, they wear two to make them more comfortable and still have the good vision from the gas permeable lens. And some people feel like the top lens sometimes move around a little bit. It's not my experience. I feel like most of the time I can alter and customize the top lens to fit pretty seamlessly with the disposable soft lens underneath. But some people have had those issues. And so if you look at the recessed contact lens system, which is in your bottom left corner, then it basically we create a cutout on a custom soft lens, not a disposable, on a custom soft lens, where you could actually put your gas permeable lens in the center of that cutout and then put the lens on the eye. And therefore, it's almost like you're embedding the top lens into part of the soft lens with that recess or with that cutout. And then again, some people don't like the idea of wearing two lenses, even though in a piggyback, it could just be a disposable soft lens that you throw away. So we have created hybrid lenses. That is basically truly embedding that gas permeable lens in the center, surrounding it with a soft lens, not a disposable, because the two of them together make it non-disposable. And so you could have a little bit more comfort, closer to a soft lens and still have the vision with the gas permeable lens. And most people are very familiar with the scleral lens, which is our last major category. Now it can be a standard one, meaning the fitting parameters are much more prefabricated. There's sort of limitation to how much you can change and add optical or fitting features to it, and different levels of scleral lenses that we'll see a little bit later. Some of them can even, work well with patients with keratoconus and other coexisting conditions on the eye. So that's basically the sort of very brief summary of what all the lens categories are available for keratoconus patients. Taylor, was there any follow-up questions that Megan may have asked, or do you think that sort of hits the point for what Megan was looking for?
I think that hits the point. You went over all the different options, and I think she just has to work with her doctor, because based on the shape of her particular cornea, maybe one of these lenses will work better than the others. And so Absolutely. I just want to emphasize that just because one person really has success with a certain lens, it doesn't mean that that will necessarily be your best fit. So just work with your doctor about that.
Such a great point. And remember, just because one specific design or one brand of a lens fails, doesn't mean that another lens in the same category wouldn't work for you, given more customization, fitting ability, or features, I should say. So remember to kind of look into that as well, Megan. I love your point, Taylor. Thank you so much for mentioning that.
Well, our next question comes from Jeff, and he says, can I wear contacts if I have bumps on my eye? How do I deal with them if I have keratoconus?
Great. So, obviously that's, we had talked about, or I alluded earlier, that there are lenses that sometimes, given the situation with coexisting conditions on the surface of the eye, may require a little more customization or maybe creative, use of the more traditional category of lenses. So the short answer is yes, you should be able to wear contact lenses, Jeff, even if you have these bumps on the white part of the eye. And assuming, and for everybody listening thinking, what does that mean? Well, I'll talk a little bit later. Taylor and I will delve into a little bit more depth about what we're talking about when we say bumps on the white part of the eye. But assuming those area bumps are not a direct result of, say, a medically required procedure, because there are different procedures that may leave different area of the eye with a little bit of a elevation or bump. So assuming that's not a surgically induced situation because you need that procedure, then the more common reasons for having these quote unquote bumps on the cornea or on the white part of the eye are typically three situations, and the first two are the most common ones. So it's either a pinguicula or a pterygium. And I know those are like, what are those words? There are a lot of syllables that doesn't even, sounds like I just made them up. And I know that. We'll talk about what they are. The third one is potentially on the cornea itself, not on the white part of the eye, and much more associated with keratoconus, this third one. The first two, anybody can get it, right? The pinguicula and pterygium. You can have it without keratoconus, you can have it with keratoconus. But the third one is a keratoconus nodule, which is on the cornea, and it's a little bump that we'll talk a little bit about perhaps at the end, that keratoconus patients can get, especially pending sometimes it depends on their habit and the severity of their keratoconus. So we'll talk about that, but let's touch up on the first two because they're more common and it can affect either patients with keratoconus or without. So again, I find that pictures are worth 1,000 words. So let's take a look at some of the pictures from my clinic of what a pinguicula looks like. So this is the first one, and Taylor's circling that little sort of yellowish, orangish area, elevated area bump right on the white part of the eye next to the cornea. And you can see the cornea basically ends where the brown iris is because it's right in front of it. So wherever the iris color ends you can think of that as an approximate location where the cornea ends. And then it starts with the white part of the eye and a thin membrane called conjunctiva on top of the white part of the eye. So Taylor, if you don't mind circling that area again, so that little bit of bump is that small one that's not touching the cornea is called pinguicula. And so it is a yellowish or orangish raised growth on the conjunctival, which is conjunctival membrane, which is a thin membrane that covers over the white part of the eye, and the blood vessels are underneath. And so this little growth does not typically stays on the white part of the eye. It may grow, but it doesn't usually extend into the area of your cornea. And that's important to remember because that's one of the differentiator of what the difference between a pinguicula and pterygium that we're going to see a little bit later. So a pinguicula is really an alteration of a normal tissue that can result in deposits of protein, lipid, or fat, and calcium. That's why it's got that little bit of tint to it. And because it's an elevated growth on the white part of the eye, any type of contact lens that needs to touch the white part of the eye or rest on the white part of the eye will be affected with its fitting capacity and stability or positioning of the lens. And that can affect vision, or that can affect comfort of the wear of the contact lenses. And that's why I think Taylor, do we have another picture after this that's also pinguicula? There. So here you can see actually a patient of mine, and Taylor is showing you the edge of the scleral lens as well as part of the pinguicula. So you can see that if we're going to use a rigid material that is going to directly sit and land on the pinguicula, it's going to cause pressure on that area. And because that area can be associated with extra blood vessels, I usually tell my patients these pterygium and pinguicula is sort of like a callus tissue on your fingertip, right? So now when you go, grab your tool or something like that, it either feels a little different or sometimes it may be uncomfortable touching something with that area. So you can imagine that that pinguicula may or may not be uncomfortable with the lens. In fact, this patient doesn't feel any discomfort, just bothered by the cosmetic factor of having the eye being irritated by the lens without pain, without discomfort, but the blood vessels look more red because your pinguicula or pterygium can have extra blood vessel and gorge associated with the tissue. And so what is the pterygium then? The next picture you'll see is at the beginning is a pterygium that, remember, you can see that part of the growth, the elevated growth, is actually now touching or had advanced into the cornea area because part of the color part of your eye, your iris, has been covered up, showing you that the lesion or the growth is on the cornea. So pterygium is from the Greek word for wings, if you could believe it. So because a lot of times it looks like a triangular formation, so it looks like a wing of a bird. And so that's where the word comes from. And like I said, the differentiator is that it advances into the cornea and can continue to grow. In fact, I'll show you here a patient where on the nasal side, exactly, you can see the blood vessels being dragged by the pterygium tissue, and it slowly has already encroached the area of your pupil. So that means that you're going to have your vision definitely affected. and you can see that haze formation in front of the pupil. And in fact, this person has pterygium on both sides, so you could actually see there's a little bit of raised lesion that has started, that actually has formed on the white part of the eye on the other side. And there's actually that wing structure that touches the cornea, but the exposure of the light makes it less visible. So this person has sort of, has pterygium on both sides. So it often appears more red and pinkish because there's more blood vessel association, as you can see here in this image. And so now any type of contact lenses that whether it touches the cornea in this case, because the pterygium is covering a good 25, almost 30% of the cornea. So whether it's a lens that's resting on the cornea, like a small gas permeable lens, or a larger, like a hybrid lens or soft or a scleral lens that's resting on the white part of the eye, now it's going to be affected on both with across more category. So a pterygium's impact much more extensive. So, however, I'm not saying that we cannot wear contact lenses if you have pink guicula or if you have pterygium. You can. It does just take a little more customization in the lenses. So this is a hybrid lens, right? This is a sort of early moderate amount of pterygium. And Taylor, if you could kind of circle exactly. So a little bit of the pterygium is on the white part of the eye. You can see where it originated and the blood vessel kind of being dragged into the cornea. However, I have that sitting underneath the soft part of the lens under a hybrid lens. So the yellow, I put a solution in there so you can see where the center of the lens is in this hybrid lens. So wherever that lens appears more yellow, that's not the natural appearance. I did that so you could see. So that's the area of the gas permeable lens, the harder material that keeps the shape so that the patient can get good vision. And then outside of that yellow circle is all surrounded by a soft lens. And therefore that soft lens can act more like a piece of cloth, and it can flow over or drape over a small amount of elevation, such like a pink guicula or pterygium pretty well. So this is not the only solution, but this is one of the solutions that sometimes I find for my patients with pterygium that could work pretty well. So that's again just one example. And I think actually I think now that I'm saying that, there's another example that I have. And now this is me serving as a model for this when we went to a meeting for this more advanced customizable scleral lens that is taken from an impression on the eye. I think, Taylor, have you ever been to, when you go to actually, what am I saying? Of course you do, because you have beautiful teeth. You go to your dentist's office. I was going to ask you, have you ever been to a dentist? But that's not the right question. You know how when you go to your dentist's office, if you were to say want to make a night guard, or if they want to, if you've seen people like getting a crown, they would bite into this tray of blue gel, and then for
Yep.
a short period of time. You have seen that, right? So it's basically
I had to do it for my braces, actually. I think I still have it.
Okay, well, that's why you have such beautiful teeth and beautiful smile.
Thanks.
So you'll remember that it's a very pliable material that you bite into, and it slowly stiffens, and then they remove it once it's fully formed. So we could do that for the eye as well, and then create a scleral lens out of it. And in fact, I think they're working on creating a gas permeable lens out of it too in the future. So very exciting. That's why I said it, it's not, there's a lot of breakthrough, and it's not just in scleral lenses, but it has been mostly scleral lenses in the last 5-10 years. That part is true. And what you're seeing here, you would think, why does that lens look very it looks like an art project. It doesn't look like what a contact lens should look like, because it's not equally round. It's not all the way smooth. In fact, those two little divots that you see, one sort of facing you on the screen, one is away from you on the screen, that's the area of pterygium of the patient that is growing into the cornea. So we use we have to use this impression method to make the lens much more pliable, to be able to scan that shape and create a scleral lens for patient with bumps on the eye. So again, more customization. It's not sort of a round and not a standard round scleral lens. So that's another option that is possible for patients with either pink guicula or pterygium. And again, I obviously cannot name every single possibility, but these are sort of two that I think are are the newer technology that are exciting for me. And just before we leave this question for from Jeff, I did say that there was a third situation, Taylor, and that is maybe the bumps that that Jeff is referring to could be a keratoconus nodule. And what that is, and again, we could, because I think we don't really have the time to, get in depth into what the this third situation, just because we require more of an in-depth clinical discussion about the different type of fitting parameter that may be needed to overcome and to get a well-fit lens over keratoconus nodule, and sometimes maybe require a combination of surgical treatment management to actually remove the nodule first before we return patient into contact lenses. So I think it's going to be a really good question that we could answer in the future. So I just want to kind of give shout out to those keratoconus patients that may be thinking, hey, I think I've been told that I have one, and is that the reason that I'm not tolerating my lenses as well? So I'll, those of you who may have questions or please write in about keratoconus nodule. Let us know what your specific questions or experiences are that you want to share, and we'll include your story in a future episode. And Taylor, I think you and I had talked about the fact that you were actually looking up like these pterygium and pinguicula, and you had a very interesting question for me.
Yes, so while I was researching, it was saying that the exposure to UV light, dust, and wind can kind of bring about these growths. And I just was thinking, are keratoconus patients more susceptible to developing them if they undergo crosslinking? Because with crosslinking, you use that UV light. So I just wanted to get your thoughts on that.
Yeah, really, really good thinking. Good question, because the short answer is I don't believe so. Have not seen any literature or case reports in medical literature that have reported the effect such as pinguicula or pterygium formation after UV light treatment with crosslinking, corneal crosslinking. But the thought is an interesting one, because while we don't quite know what the pathogenesis or the cause of the formation of these pterygium and pinguicula, we don't know exactly what the causes are. We think there's an irritation source, whether it's from chronic exposure of UV light, so that more oxidative stress on the surface of the eye, or dryness of the eye, exposure to the wind, so that again it dries out the eye. And you could think of it as then when you're blinking, we constantly blink, then you have a little more friction that's built up that can then cause inflammation and irritation. And so we used to think, and that's the reason why we used to call it surfer's eye, right? Because it's people who are constantly outdoor, getting a lot of UV exposure. And so we thought maybe that's the oxidative stress is the reason. So number one, if you think about corneal crosslinking, it's not chronic exposure, right? That's number one. Number two, it's on the light. It should be controlled. If you use the proper device, it should be controlled. It's not a diffuse illumination that covers a large area. It should just be to the size of your cornea or less. And therefore that UV light should not be technically, it's a one short episode, but also shouldn't really be diffusely illuminating the white part of the eye. And I think, in my opinion, for those two reasons, that's likely why we have not seen any such clinical concern being reported. But great question.
Perfect. Thank you so much, Dr. Chang. That was wonderful. So next month, look for another Chang Reaction episode. We release these every month on the first of the month. And please send in your questions to us if you have a question about maybe the keratoconus nodules that Dr. Chang mentioned, but any question that you have. So please go to the For Patients tab on our website, that's nkcf.org, and you'll see the Ask the Expert Chang Reaction. You can post your question there and we'll try to answer it in an upcoming episode. And finally, NKCF operates with the support of friends and donors. So if you feel the urge to support us, you can make a much appreciated online gift to the UCI Foundation. In closing, I just want to thank Dr. Chang again for doing this with us every single month. It's so much fun and we're learning so much. So thank you.
And I'm having a lot of fun too. So please ask Taylor and myself any questions you want. Those of our listeners out there, thank you for your support and listening in.
Thank you so much. Bye, everyone.
Bye.